How do new rapid TB tests work for children? Imagine being able to diagnose tuberculosis in a child quickly and with less discomfort. That's what new rapid TB tests aim to do. These tests use advanced molecular techniques to detect the genetic material of the bacteria that cause TB, called Mycobacterium tuberculosis. Instead of relying on traditional sputum samples, which can be hard for children to produce, these tests work with easier-to-obtain samples like saliva, stool, urine, blood, or gastric aspirates. This shift is especially important because children often have fewer bacteria in their bodies, making traditional tests less sensitive. They also tend to have extrapulmonary TB, which affects parts outside the lungs, further complicating diagnosis. The core technology behind these tests is nucleic acid amplification. This means they look for tiny pieces of TB DNA in the samples. For example, the Expert MTB-RIF Ultra assay is a widely used test that can identify TB bacteria and also check if the bacteria are resistant to rifampicin, a key TB drug. These tests can give results in about an hour, which is a huge advantage for starting treatment promptly. Some newer devices are even handheld or smartphone-sized, making them portable and suitable for use in clinics or remote areas with limited lab infrastructure. Because collecting sputum from young children can be difficult or impossible, scientists have developed tests that work with saliva or stool. These samples are non-invasive and easier to collect, especially in young children who may not cooperate with coughing up sputum. While stool-based tests are slightly less sensitive than sputum tests, they still offer a practical and accessible way to diagnose TB. Blood tests and urine tests are also being explored, but they are not yet as widely used or validated for TB diagnosis in children. Despite these advances, some challenges remain. For example, the sensitivity of stool tests can vary, and collecting gastric aspirates requires a bit more effort and training. Researchers are continually working to improve the accuracy of these tests and to develop new methods that can detect the immune response to TB or specific gene signatures in children. This ongoing research aims to make diagnosis even faster and more reliable. The importance of these rapid tests is clear. Every year, over 1 million children fall ill with TB, and many go undiagnosed because traditional tests are not suitable for them. Faster, less invasive testing can lead to earlier treatment, reducing the risk of severe illness and death. It also helps public health efforts by identifying cases sooner and preventing the spread of TB. Still, it's essential to remember that these tests are tools to support clinical judgment. Healthcare providers will interpret results alongside other clinical information and may recommend additional tests or follow-up. In summary, new rapid TB tests for children use molecular methods to detect TB bacteria DNA from samples like saliva and stool, making diagnosis faster, easier, and less invasive. These innovations are crucial for overcoming the unique challenges of diagnosing TB in young children and can significantly improve treatment outcomes. As always, if you suspect TB in a child or need diagnosis and treatment, consult healthcare professionals who can provide personalized advice based on the latest guidelines and evidence.